Welcome to the Marathon Podcast brought to you by Zandu Fast Relief. Myself, Ganesh Bhagwat, a passionate and ran more than 300 plus marathon events, also a brand ambassador for a lot of running events, and a motivational speaker. So, as we speak, the running community and run as a sport is kind of gaining a lot of popularity in India. But we firmly believe that the training programs for runners is actually lacking. And for that particular context, we are going to talk about prevention. And with me, we have our esteemed guest, Dr. Ali Irani. Welcome on board, Dr. Ali Irani. So let me introduce Dr. Ali Irani. Dr. Ali Irani, ex physiotherapist for the Indian cricket team. Also, he is a celebrity physiotherapist, as well as he is the head of physio department for Nanavati Max Super Speciality Hospital, Mumbai. So, Dr. Ali, you have suggested to name this podcast as prevention. Can you just elaborate on it?
See, in sports, it's very easy to treat.
True.
All sportsmen, because it is competition, they want to do the best.
True.
As they're doing the best in that process, they may get injured.
That's
So
right.
by now we have evaluated, depending on the sports, we have evaluated all the injuries, what type of injuries and what should be the treatment.
Right, right.
Now, coming to the part of the, let's take example of the marathon runners,
That's right.
because the whole program has to do with Zandu Fast Relief Marathon, which is going to coming, and it's almost now around the year.
That's right.
So I would emphasize now for all sportsmen, even marathon runners,
That's right.
we want to emphasize on prevention.
Okay.
So today our topic is going to be prevention.
Okay.
So we are going to open each word of PREVENTION. So what each will represent, like you said, the first one,
That's right.
P, is for peak fitness.
True.
So I would always advise a marathon runner not to enter if they are not in peak fitness.
Absolutely.
You being a marathon runner,
Right.
you must have experience
That's right.
which marathon to take part
Absolutely.
and whether you have that capability. Are you in peak fitness? We call it when you are giving your best performance, you are in peak fitness. You have to be in peak fitness.
Absolutely.
And it has to remain.
True.
So today's topic, we want to work, and I want all the marathoners to understand prevention.
True.
If they work on this word prevention, they will excel.
True.
They will perform better.
True.
And I'm sure they will not get injured.
So when we first speak about the first alphabet, which is P, so Dr. Ali, whenever there is a conversation between my fellow runners, we always feel, how do we define this peak fitness for running a marathon and a general fitness? If you can elaborate on it.
See, fitness should be divided into two parts. One, we call it the general fitness.
True.
So you warm up, you can perform, you're running every day 5,000 kilometers or 5,000 meters or 10,000 meters. You're doing it every day.
Right.
And you can do it very comfortably in the time that you are doing it.
True.
Once when you have done in a better time.
True.
So I will call that as your peak fitness, the best
Okay.
time. But today, suppose you have done something in 40 minutes.
Yeah.
And next day, the same run, you are doing it in 45 minutes or 50 minutes.
Okay.
So that's not your peak performance. So
Okay.
your best timing should be considered as your peak performance.
Okay.
And you are very comfortable. There was a flow.
Okay.
So that timing has to be recorded by yourself.
That's right.
So, and try to break that. So breaking that, then you are going one step up in your peak performance.
Will you also see, apart from the timing, is mileage also can be a peak performance?
Of course. The same timing may. Today you could run, suppose, I would say,
A 5
5
kilometers.
kilometers.
That's right.
But the next day in your training, you have very comfortably done 8 kilometers. Comfortable at the same,
At the same
you are
time.
going same.
True.
So I would definitely call it that you have improved your timing. So it's not only the time watch-wise,
That's
it
right.
could be the distance. You have gone very comfortably 10 kilometers or 8 kilometers at the
True.
same comfort.
True. So, Dr. Ali, we will go to the next alphabet, which is R, which is regular training. So, what is an ideal training plan? Because we as runners, we follow a training plan, which is a base training. We try to build up the training before the marathon and we kind of taper the training just before the marathon. So, what is your inputs on that in terms of regular training is concerned?
So, keeping the second alphabet in mind, R, which is regular training. What I mean in this case, for any sports, there is an off season and there's an on season.
True.
So, when we are talking about off season, suppose you know that next 2 months there won't be a marathon.
Right.
So, I would still tell you 5 days a week to practice your whatever you are doing.
That's right.
Right. Of course, going to gym also.
Okay.
So, a better version of gym, lighter version of your running.
Okay.
And one day should be rest.
Okay.
And or once a week you will run your full 10,000 kilometers or 5,000, sorry, 10,000, 10 kilometers or 5 kilometers.
True.
That's what you're going to do.
True.
But once a week you will go to the gym and strengthen all the muscles.
True.
And once a week, complete rest.
Okay.
Now we have come into the season.
Right.
You know, there's a now it's going to be other way wrong.
Okay.
You will be doing more of your training,
That's right.
5,000, 10,000, 5 kilometers and 10 kilometers, you will be doing it.
Right.
And you will go to the gym only once a week for
Okay.
muscle training.
Okay.
Again, once a week, there should be a rest.
Okay.
So you have to prepare regularly. It's not that most of the marathon runner, when you see, they 1 month before the marathon or 15 days before the marathon, they start practicing.
That's right.
So they will never reach in their short time the peak fitness.
Okay.
So they will come with a lot of injuries. Or maybe when you look back, you ask them, 3 months they have not practiced.
That's
2 months they have not done anything. They have gone for a holiday, come back after a holiday of
Right.
1 month or 45 days, and suddenly they want to run 10 kilometers.
Okay.
So that creates a lot of injuries. So prepare yourself. When I say regular training, if you are going to be a marathoner,
Right.
definitely you have to practice every day except once a week. So
Okay.
the training may not be to an extent or going all out,
Okay.
but you have to be, I call it, keep your engine tuned.
So a lot of people say when they are just near to the marathon event, for example, there is a Tata Mumbai marathon which is going to happen. You need to taper down your training program. What do you really mean by that?
So if you know that you are at a peak fitness
Right.
during the training you have done,
That's right.
just before the event, you can taper down, reduce it, or taper it up. So you start with 2 kilometers. You want to start now getting into the season,
That's right.
increase by half a kilometer or 1 kilometer every day. So over a period of a month, reach the peak.
Okay.
Right?
Okay.
And then maintain yourself there.
So, Dr. Ali, I generally follow a training program for my marathon training. Is 3 days I go to my gym and 3 days I do my runs. Obviously, one day I've kept for long runs and one day is the rest. What is your point of view on this kind of training?
So are you doing your strength training and then running, or 3 days in a row you do strength and 3 days in a row you run?
So it's alternate. So if I go Monday to my gym for my core and my strength training, then Tuesday will be my runs. So Tuesday can be interval, Tuesday can be speed, and the various kind of runs that we keep on doing it. And Sunday we keep it for long runs.
I explained it the other way around.
Okay.
Now, if you were in the season,
That's right.
you could run every day and keep one day for your strength.
Okay.
And when you're off season,
Okay.
you are going to emphasize, then this alternate days is much better.
Okay.
Or go for strength, go for your running every day and one day strength. And other way around, during the season, every day running, one day strength. Off season, every day strength and one day run.
So the runners actually is getting confused. Now the season is throughout the year. Okay, so everybody wants to kind of run each and every marathon. They want to run more of ultra marathons and all. Then how do you look at this then?
As I come closer to the event,
Right.
and if I'm doing 10 kilometers,
That's
then
right.
I'll try to reach every day that, or alternate. One day I will do 10, one day I will do 5 to reduce it. So, so that body works. And
Okay.
definitely strength once a week I will go, and one day rest is very important.
Very important. So Dr. Ali, there is a lot of common mistakes a runner do during the training program. So my next question is to move on to the next alphabet, which is E. How do you evaluate, and is there any metrics for this evaluation?
Every sportsman, depending on the sports they play, You have a whole number of batteries of tests that we do them to
True.
see their endurance level,
True.
their flexibility.
Okay.
Then what is very important is the pulse rate. You must
Okay.
have heard about stories the sportsman was running and fell dead.
True.
So there's a formula. You should not take your pulse rate more than 220,
Okay.
right? So 220 minus your age.
Okay.
Suppose a person is 30 years old. So 220 minus 30 should not take the pulse rate more than 190.
I'm 52.
So
So 220
you
minus
cannot
52.
take it more than 170. To be safer, it should be 200 minus your age.
Okay.
So at running till the pulse of 150,
That's right.
you're very safe.
That's
So
right.
when I say 220 minus an age, any sportsman, whatever, they are at 20, so 220 minus 20, they can take the pulse up to 200.
True.
But better 200 minus the age, you are on a safer zone. Once you cross that, you are entering a danger zone.
That's right.
Right.
So are you talking about average pulse rate, Dr. Ali?
Yes. When you're taking your pulse, we usually take it for 6 seconds also and
Yeah,
add a zero to it.
that's right.
So you should not cross. The best formula what we do with a sportsman is 200 minus your age. So do any activity, your
True.
pulse should not cross that. Nowadays pulses are on the watch.
True.
You can find out it is as you are running. So one train for that. So
Okay.
today you may take your pulse in danger zone. It may take you to get into a danger zone 2 hours.
That's right.
Right. But people who have just started running now, they may get into a danger zone maybe in 15 minutes.
So generally I monitor my pulse rate after, after the end of the marathon or during the runs also I keep on checking my watch in terms of my pulse rate is concerned. But when I do my speed runs, the pulse rate really moves up to 180, 185.
Intensity. But that's for a short duration.
True,
You
absolutely.
can't do it for a long thing.
Okay, because that's where we kind of train
Yeah, so
for
heart
600
rate, yeah.
meters and then come down for 400 meters, and that's where we have to keep the pulse rate in
More the
check.
intensity, more the pulse rate.
Okay, but that's not a danger zone in terms of when you're training it.
Just let's give you an example. You're walking, forget you're
True,
running.
true.
So you may even walk for 4 hours and still your pulse will be in control.
Okay,
Because there is no resistance. When you increase the resistance, when you want to go uphill, the pulse
the
will
pulse
be
rate
fast.
increases. Yeah.
So that's a training for that. So we have to evaluate and see whether you are made for 5 kilometers, whether you are made for 10 kilometers or 40 kilometers.
Do you have, so we have spoken about the metrics in terms of the pulse rate that is 200 minus your age. Any kind of other technique which you feel can keep the checks of your pulse in control?
Nowadays, a lot of electronic gadgets are available. Use them.
So, Dr. Ali, as a marathon runner, everybody wants to elevate their running in terms of the mileage is concerned. Somebody wants to move from a 10 to 21, from a 21 to a full marathon, from a full marathon to an ultra. So, the context to this is coming to the fourth alphabet, which is V, which is a vision. What do you think is the mindset that goes behind this particular vision, and how do you create this kind of mindset? Because I want to run ultra, I want to run the comrades. How do I kind of get that mindset or my vision to kind of run a particular mileage?
See, every sportsman has a vision of doing that sports.
True.
Maybe it's your passion.
Yeah.
But one day you want to run a marathon.
Absolutely.
The best timing.
Absolutely.
That's your vision.
Absolutely.
Some has a vision, if I'm going to run, I'll represent the country. I'll get a medal for India.
True.
So that's the vision. Some will say, for my fitness, I want to run. We have been having a lot of industrialists who are just running.
That's right.
Maybe just for the fitness.
True.
Right? So when we're talking in details of the vision, you would be saying how the vision can differ.
That's right.
So each one has a vision.
True.
And I think so without a vision, there is no sportsman. Every sportsman has a vision why they are running. Maybe plain passion.
Absolutely.
Maybe for fitness.
Absolutely.
Maybe just to keep themselves going. Better
True.
endurance.
True.
Right. So, and some do it after some time. I said, there's a kick.
That's
if
right.
you don't run, you're not comfortable. We'll talk more in details about it in a program that will be exclusively talking only on vision.
Yeah, I think so. We need to speak about that because there are a lot of injuries which happen when you actually move to your passion or you move to your vision, and how to kind of cope up with those injuries, not to go into that particular format per se.
Definitely.
So, Dr. Ali, whenever there is a conversation between runners and all, there is also a confusion, basically, and that's where I want to touch base on the fifth alphabet, which is endurance. So, can you just explain the difference between endurance and stamina?
See, there are two types of endurance. We have a cardiac endurance and we
True.
have a muscular endurance.
That's right.
And to measure it also is different.
Okay.
So let's give you example about your cardiac endurance as we spoke earlier.
Right.
Your pulse rate,
That's right.
right? How your pulse rate going on.
True.
And the muscular endurance, I'll emphasize on the biggest enemy of a sports person
Okay.
is lactic acid.
Okay.
So once the lactic acid sets into your muscle,
That's right.
you may get cramp. They're not going to allow you to move further.
True.
So what delays the lactic acid? So we have to see how it is related. So
Okay.
what will delay the lactic acid? More the oxygen.
True.
Now oxygen is going to come through your lungs.
Yes.
Our lungs were made for 4.5 liters,
True.
but most of the Indians have 4 liters. But definitely marathon runners all have 3.5 liters plus. I've seen marathon runner even with 5 liters of vital capacity.
Okay.
Yeah. I've seen people doing pranayam 4.5 liters of vital capacity.
Okay.
But all those who died during COVID, they were less than 1.5 liter capacity. So that means let us assume a lung as a container.
Okay.
So when you breathe, so only 20% of the air is oxygen, rest is nitrogen.
Okay.
So what happens? Your blood flows around your body, comes to the base of the lung.
Okay.
They only come for that. When you breathe in, that air touches the impure blood. The 20% oxygen is taken by the blood. It becomes pure, goes to the heart. Heart pumps it all over the body.
Okay.
So more the container, better the oxygen level. So
True.
if you have a 4 liters container, you are taking more oxygen.
True.
More oxygen means better quality of blood.
True.
Goes to the heart. Heart puts it all over the body.
True.
So one, if you have more oxygen, better vital capacity, more oxygen, there's a delay of lactic acid.
Okay.
So more the delay of lactic acid, you are running very smoothly.
Absolutely.
So there's where the muscular endurance come to play. We want to enhance that. So with your training, you must be till today emphasizing that I can run 40 minutes, I can run 1 hour, this is my training program.
That's right.
You never thought about what is your lung capacity. So I want all the marathon runners to know they should have 3.5 to 4.5 liters of lung capacity.
The lung capacity.
So if you increase your lung capacity, you are automatically going to run better. There's more oxygen going into your body.
So, Dr. Ali, you spoke about cardiovascular endurance. So, we as a runner, we do a lot of hill trainings before a hill marathon comes into picture. We do a lot of interval training. We also do long distance, slow running, LSD training, basically. So, what is your point of view in terms of ensuring that the cardiovascular endurance goes to the next level?
Off season,
Again.
only in practice.
Okay.
Do all this new thing that you want to do, you want to improve, all that should come in off season.
Okay.
Once you come into the season, it should be straight whatever you're doing your event. So think that every day you should think you're doing the event.
Okay.
Training off season, try new things, uphill, downhill to build your endurance. Maybe you have to go to gym and build more of muscles.
Okay.
All that is going to be for off season. So when I say off season and on season, no doubt, marathon is round the year.
True.
But there's a phase that you have done 2 marathons in a row.
That's right.
So it could be only for you only. Okay, I've
That's
done
right.
2 very well. Now wait, I will go slow, or I won't go for 40. I will just do 10 this time. Or some marathons you would like to just keep going, so I'll do
True.
5.
Absolutely.
It's not necessary you have to do the same thing on every marathon.
That's precisely we do in terms of we kind of select certain marathons where we just want to enjoy the route.
That's all.
Certain times I pace with people, with runners to ensure that they do in that particular time. So I go slow on that. So that becomes my kind of a regular training per se. One more point which I want to touch base is the anaerobic endurance. What is your point of view on that?
See, aerobics has its own. So when you are doing your running every day, practicing every day,
That's right.
is aerobic
Right.
because it's continuous movement.
See.
And when there are phases that you are doing certain training, which is not aerobic,
Okay.
right? What we call it, there are phases. I feel both the trainings are important.
So, Dr. Ali, let me go to the next alphabet, which is N, which is nutrition and hydration, basically. So, we always feel we are well hydrated. We have the good and the good food before the run, after the run, during the training programs, and all. But still, we feel there is a less of hydration when we are running. What is your point of view in terms of how you want to elaborate the nutrition part and the hydration part? That's pre, post, and during the training programs.
I'll simplify it. So please remember, our body has been made in such a way. They tell you.
True.
So please remember, thirst is a signal that the body requires fluid.
Absolutely.
So there is no rule that you should not have. If the thirst has come to you, you should have fluid.
True.
But of course, before the event, 2.5 hours before the event starts,
That's right.
you can hydrate yourself. Till the event, between the event, during the event.
True.
As soon as you feel thirsty, hydrate yourself.
True.
Because thirst is a signal that the body requires fluid.
True.
Now, coming to the other nutrition that we have. So, whatever we are going to eat, it's going to be fat, carbohydrate, and protein.
Absolutely.
For an example, you have a two-wheeler, it runs on petrol,
That's right.
but the petrol pump owner has added kerosene to it. Your vehicle will run, but there will be a lot of jerky movements.
That's right.
So, this is what I want to the sportsmen to understand. Okay, your fuel when you're running is carbohydrate.
That's right.
So if we have done a test called carbohydrate loading.
That's right.
We had made people run on a treadmill.
Okay.
So they were on the normal food. So half group where 4 people, 2 were put on carbohydrate, 2 were put on only protein till next day, same time.
Okay.
So next day when they were running, the people who had only carbohydrate, they ran better, smoother and more timing.
True.
But those who were better runner also, because they were on high protein, they could not run the way they had run a day earlier. So it's called carbohydrate loading. 3 to 4 days before the event, you can load yourself with good carbohydrate.
Okay.
Because that's your fuel.
Okay.
But once the event is over, you can go on protein because protein will help you for the repair work,
For the
whatever
muscle
damage
repair.
is done. Yeah.
Okay.
And I feel the ratio is very important. We say during the event, up to 70% you can have carbohydrate, 20% protein, and 10% fat.
Okay.
But before the event or a day before the event, also you can start only carbs. So load carbohydrate. That's your fuel.
Okay.
If the fuel is known, you are on the right fuel, you will perform better. So none of the very few maybe marathon runners are even thinking in that terms.
That's right. So there is also a fear. Basically, I've seen a lot of runners in terms of hydration is concerned, where they hydrate too much before the runs. Hydration chahiye. You need to have a lot of water, electron, enerzal, whatever it is.
There's a test on kinetic,
Okay.
You can test your body whether it requires
Oh, really?
water or yeah. So it's those who are expert of that can immediately check your body and tell you require more fluid and not.
So when do you want to do that test? Generally,
Before the event, you can do it. So
For
if you're
3
well
days?
hydrated,
3 days, a week?
No, same day also you can do it.
Oh, really?
Yeah, but as you are training, you can do it every day and then you'll get an idea of it.
So, Dr. Ali, let me go back to the next alphabet, which is T. That is called the technique part of it. So, as per your point of view, what are the good elements in terms of technique to run a good marathon?
I feel for any sports, the change of technique
Right?
should be done in off season.
Okay.
I'll give you a very good example. We had a weightlifter, which she was competing in Canada. And we
Okay.
were very sure that she will definitely get a bronze medal at least.
Okay.
So it will be silver or bronze. So the coach tried to change her technique. If you change the technique, you will lift another 15 kilo, and with another 15 kilo, you could be a gold medalists.
That's right.
So this was just one day before the event. The technique was changed, and
Okay.
she got a shoulder dislocation out of the tournament.
Just because of change of technique.
Change. So I would always advise you all, whatever you want to try new, should be off season, not 1 week, 2 week before your marathon.
Okay.
So that whatever you were training, do that. But you want to try something new, change of technique. You want somebody has advised you. If you take a little step further, a little, try to stretch a little more, your timing will improve by 15 minutes. All that has to be done off season.
That may also
Not-
cause injury, basically.
Yes, not during the season. So that's why we call that off season and on season. So
Okay.
on season, purely do what you know, whatever you have practiced. And off season, you can try new things to see how you can better yourself. So change of technique, everybody should know, should be during the off season.
part of it.
And then whatever you are doing the techniques. So whatever you're good at it. So
right.
your coach wants you to be a better,
That's right.
but your body tells you with
Right.
the change, if you feel you're not comfortable, you should not. Like you do your 5,000, suppose in X time,
True.
and somebody is advising you, if you do this, you will do it much better timing.
True.
But your body is the best judge. If you feel I'm not comfortable,
True.
even if I change the time, better my time, but I'm not comfortable doing it, I feel don't do it. So your body is the best guide to tell you for the change. And if you're changing any technique, please do it off season, not during the season. Get the right advice. There are evaluation.
That's right.
If you have a good physiotherapist, they can evaluate your muscle. We grade your muscles.
That's right.
Which muscle is weaker, which is stronger, or a good flexibility, which we are not doing. So if there's a warming up program in every sports, you'll also warm up.
Absolutely. We do that.
Yeah.
That's right.
Why we warm up? Even car, automatically, you will see, we'll raise the car.
True.
So we feel the fuel goes up to the piston, to the engine, so it's warmed up. Then we pick up the car.
True.
Similarly, body requires a good warm up. So blood flows to all the muscle fibers. Then a good stretch. Good stretching will also avoid injuries.
Okay.
Stretch your muscle, which has to be done, especially runners, the ankle, the calf.
Yeah, that's
You
right.
have to stretch it. Your hamstring.
True.
Hamstring stretches are very important. Then your back. Then in certain sport, we have to stretch the shoulders, the neck. So depending on that. And then when you finish the event, there is a cool down program.
That's
If
right.
you took 20 minutes to warm up, so your cool down should be at least half the time, 10 minutes.
Okay.
If you took 30 minutes of warming up, cool down for 15 minutes. So I prefer the cooling down program. You can do it on the floor exercises,
True.
stretching exercises.
True.
Cool down gradually.
True.
After your event, you can't just stop and start gulping water. Just, I'll explain you, even drinking of water,
That's right.
there's a way to drink it. You can't gulp the water like this.
True.
So because we have a air pipe and a food pipe. Even a droplet, small drop goes into the air pipe. It goes into your lung. You may get cold. You may get so many other complications with it. So water needs to be drank. One sitting, you cannot stand and drink.
True.
So in sitting also, have it sip by sip. So if you're having it sip by sip, believe me, your thirst also will go faster than gulping a whole bottle.
So I take your point of view when there is pre as well as, after the marathon, the way you have told to kind of consume the water. But what about during the marathons? We are always on the rush. We just take the glass, we drink it and we just run.
As I said earlier, thirst is a signal that the body requires fluid.
True.
Don't deny it. Take it. As you are running, whenever you have felt thirsty, you can keep drinking.
So can we apply the same technique then? During the runs
You
also?
will see, I've seen many marathoners, they sit, they squat and drink. So somebody has explained them.
Okay.
Yeah, many you will see, even outside the country, international players, they will not drink water like that. They will squat and have sip.
Sip up, sip.
Yeah.
You want to more talk about the running gear in terms of the shoes is concerned. How do we evaluate a flat foot or a mid-rise foot and kind of take care of our shoes?
See, in the initial evaluation, when we were talking, there's an evaluation done of the footwear and of the foot.
That's right.
A flat foot will require more valgus padding to be coming inside,
That's right.
right? Or a person is having a good, very good high arch.
Right.
So maybe again there's a separate insole for it.
Right.
It's very important. And anyhow, for football shoes, you can't play cricket.
True.
With cricket shoes, you can't play badminton. So every sports have their own shoes. So even in running, why not? Let's go back 30 years back. Most of the marathon runners coming to me,
Right.
they were running barefooted. Their practice was barefoot. Yeah. And their injury was not knee pain or ankle pain. More it was to do with cuts.
Oh,
The bottles thrown at the road and they should run on the road and cut their feet. Right?
okay.
But it has changed now. Then doing their body composition, we found they needed fat more. Their fat content was so low. Most of the Indians have more than 30% fat content. Yeah, and they were the only marathon runners have less than 12%, less than 15% fat content.
That's right.
So we have to advise them to have more fat. We should have 18 to 20% fat content in our body.
So when you talk about the foot part of it, I think so. The taking care of the foot, that is the shoes, is also a technique, or you can say it's very important so that you don't get the injury part of it.
True. The socks are more important than the shoes. So if you wear a nylon socks, there's a friction happening.
Right.
So I would always advise a cotton towel socks. So
Okay.
it should not allow friction between the shoe and the skin or your tendo Achilles.
So what do you talk about the let's talk about the size part of it. Certain time what happens is I have a UK 9, but that UK 9 doesn't fit me. I have to go for a UK 10. So, but when I run for longer distance for about 25 kilometers or 30 kilometers, my leg actually, the foot goes a little bit ahead and it starts paining. So how do you take care of all these things then?
See, the foot, I would not say you should have a fixed size.
Right.
Nowadays there are foot scanners.
That's
Scan your foot. Because after the foot size, there are other things. There's a girth measurement of your foot.
That's right.
Then there is the muscle that is involved in the foot. The bone density of each foot.
True.
So a person who is saying that we both have 8 size shoes, but one has a healthier foot,
That's right.
that 8 won't fit.
Okay.
Where the length size, the size are only set in length.
That's right. Not the breadth part of it.
Not the breadth, not the foot going in. So I don't believe in size. Any shoes that you put your foot inside and you are comfortable, that's your size. Not numbered.
So, Dr. Ali, let's go to the next alphabet, which is I, which is injury. The most important alphabet, basically, I would say. So, any specific injuries do a runner go through when they are trying to increase their mileage or they are trying to increase their speed is concerned?
Coming to injury, our topic of the day is prevention.
True.
So to prevent any injury, it's what we are talking about till now. The right regular training, whether you are in peak fitness, whether your nutrition is right.
Right.
So definitely, if you are injured, if I
True.
say, let us first talk about if you get injured. Definitely, there are many type of injuries in runners. As I said, running barefoot is going to be very dangerous,
True.
especially most of the places there are a lot of things around the road or ground which could damage and hurt you.
That's right.
Two, you could be injured. Suppose you are flat foot.
That's right.
So you're born as a flat foot. So there are arches, there are ways to tackle that. Again, to avoid the injuries, I would say good cotton socks is
True.
very important to avoid the friction. Hydration is very important because you may get cramps.
That's right.
And then I had spoken about lactic acid, which should not be allowed to set into your body. So
True.
if you have a good breathing pattern, a good vital capacity, there's a delay.
True.
Good oxygen will delay the lactic acid. And lactic acid is the biggest enemy of a sportsman.
Absolutely.
It sets in, you are getting cramp, you can't do anything. You'll straight go down. You won't be able to do anything.
True.
And of course, any other muscle pull. Now, most of the injuries happen because you have not warmed up well. Remember.
That's exactly, yeah.
So warming up, good warming up is very important depending on the climate. A warming up in Srinagar will be different of warming up in Chennai.
True.
Chennai having 85 to 90% humidity and temperature being 38 degrees,
Right.
you don't need a warm up because by the time you're walking in, you're all drenched in your
Absolutely.
own sweat.
Absolutely.
But other way around, going at 6 degree in Srinagar and you want to warm up, I should tell the players have a passive warm up. Passive warm is a good hot water shower.
Okay.
It's a warm up.
Okay.
So next time when you're going for an event and it's early morning, most of the marathons are early morning.
Yeah.
So take a good hot shower.
Okay.
So you're warmed up passively.
Okay.
And then you wear your tracks on, and when you're walking, so you're not 50% ahead you are.
True.
You don't have to warm up that much because the body is already warmed when you came out of the house.
Absolutely.
So we have a passive warm up which should be done. And I said after the event, cooling down helps you to be preparing yourself for the next event or
Okay.
for the next day. It doesn't go sore.
True.
So, and then if an injury happens, suppose you got a cramp, you want to find out the reason.
That's
Is
right.
it because of the lactic acid setting in?
Right.
Was it you sprained it?
Right.
Was it you dribbled on something? Maybe the ground was not leveled.
That's
So
right.
you hit your ankle in a bad way. You had not stretched your ankle well. You can get, injury to the tendo Achilles.
True.
So, or your lateral ligament, usually we tumble and we get
Yeah,
lateral
yeah,
ligament overpulled, sprain of the lateral ligament of the ankle. So this all could be immediately, the first aid could be ice, and ice. But
That comes to my mind. Yeah, absolutely. Yeah, always.
or for quick, because ice will take a long time. So I use Zandu fast relief spray. So
Okay.
immediately, idea is to give relief and to freeze the part. So
Okay.
most of the sportsmen or wherever our staff goes for sports event, yes, we definitely use Zandu fast relief spray for
Okay.
immediate, and the sportsman can continue playing. So, but getting back home, I feel next 72 hours should be ice, so that you don't increase any damage what has happened inside. So there's no increase of any injury inside.
That's
To
right.
settle down, if there's a bleeding inside, it stops.
Okay.
So otherwise, earlier days they used to do massage and rub and all that.
Right, right.
So they worsen the injury. So
Okay.
I feel 72 hours best way is to freeze the part. Whether
Okay.
you're going to use the ice or whether you're going to use the fast relief.
So, Dr. Ali, you have spoken about applying ice on the injury. So, after ice, what next?
See, in 80s we had a formula called ICE.
Okay.
Applying ice, compression, elevation. Keep the limb
Okay.
elevated.
Okay.
Then in 90s we went into RICE. So R is for rest. Rest, ice, compression, elevation.
Elevation.
But 2000 onward, we straight went to price. Sports injury has a price to pay. That P is prevention, what we are discussing today.
Fantastic. Dr. Ali, let's go to the next alphabet in terms of prevention is concerned, which is O, overtraining. What are the specific injuries that you go through when you overtrain yourself?
So first we should know, why does a sportsman overtrain?
Okay.
They feel they are not performing well.
True.
So they train more than the body requires. Suppose they were training once a day, 2 hours, so they make it twice a day, or the 2 hours become 3 hours, so twice a day,
True.
3 hours or 4 hours. So the staleness occur in the body.
Okay.
So I would always advise that if you're not performing well, it is nothing to do with that you're training less. The quality of training is important than the quantity of training.
True.
You may train less, so we have to understand. Very simple sign. I always ask a sportsman, okay, how is your sleep?
Okay.
If they say they cannot sleep well, it's a true sign of overtraining.
Okay.
So we need to unwind that. So I usually see the order of training.
Okay.
I increase the hydration. I increase the sleep. I say you have to sleep 1 hour more than whatever you are sleeping now.
True.
Reschedule the training program, reduce it. So let it be quality based than quantity based. So quality right, asking them start slowly, increasing their sleep, good hydration. These are the things to bring them back into the normal sleep. Once they start feeling they're sleeping good and well, automatically, and their training program has been reduced, they will come out of this overtraining. Only idea is because they are not performing well, they overtrain.
Any early signs of overtraining?
Sleep is the
Sleep
best
is the first sign.
First, they will not get sleep. They will get up. then poor recovery, more injuries, regular injuries.
What do you mean by poor recovery?
It takes time. Suppose earlier when they were get injured in third day, they were playing again, then it will take them a week and 10 days. So the heart rate increases much faster. So if you add the record of the heart rate and
That's
pulse,
right.
that will tell you. There are many signs.
Okay.
Nowadays, we even do brain mapping for it. So if he's injured or not to come to know.
Or any other specific injuries that the runner go through when they overtrain?
Many. There's a list of it, which I want to take it as a separate program where we talk about all that can happen. Yeah, physiologically, psychologically, everything comes into the picture.
Dr. Ali, let's go to the last alphabet, which is N. Say no to drugs. I don't think it's there in marathoners.
It's in every sports. Why not? Wherever there is a test involved, maybe during Olympics, during Asian Games, it's a difficult test. It's not easy available everywhere. But if a sportsman is put under the test, then we come to know. There are so many marathons, I feel people must be using it and running. But have you ever come across after you have finished, somebody's testing you?
True. No.
So, but I feel it's not right way to be a sportsman. All sports is a gentleman's game.
True.
So, but some are taken not knowingly. Like if you'll be surprised to know, okay, even a cough syrup will come under that.
What about painkillers?
Yes. Maybe some of them, most of them. Yeah. So anything. So let us talk. What is doping? What do you call it? No to drugs is doping.
True.
So every year a list of drugs increases by the Olympic Committee. Okay, this falls under doping. And next year you find something new has come. So again, that has to be labeled under doping.
True.
So, and of course, in Ayurveda itself, there are so many things that not fallen will fall soon.
Soon, okay.
So even a cough syrup. So if you have taken it just before the event and you are tested, maybe they will take it as doping. So there is no proper definition. Anything that will increase your performance, better your performance, right? Or you will not know about your aches and pain and you are doing it.
That's right.
It could be orally, it could be through injection, it could be through capsules, it could be through food, it could be as a cough syrup, it could be taken in many forms, IV lines, right? So anything which is prohibited by the committees and you take it is doping. So
what are the consequences for that?
If you're used to it, I would say that in many camps, during the camps, to get selected for the country, they're using it.
True.
So there is no testing.
Right.
So they perform well and they go for the event. So they represent the country. But there's a fear where they are going. And there if the test happens, so they don't take. So there's a fall in the performance. So he was performing, the sportsman was performing very well because of the doping.
True.
But just because he has not done, you can't reach that level. So your performance falls.
The consequences on the body parts?
Many. Depends on what you are using, because each one of them have a different problems that they can create. Anyhow, it's not good. That's why it's called doping, and we all should say no to drugs. So I look forward in our next program to all the marathon listeners that you're listening to this Zandu Fast Relief Marathon. We are going to open up this word.
True.
All the word which is there, which you saw, PREVENTION. We'll open up each one and discuss more.
Absolutely.
You can also send your questions to us and we will see that we answer your questions.
The runners are waiting for it. Thank you, Doctor.
Thank you.
Thank you, sir.